I don't know.
You're doing good.
Was I?
Yeah.
It's warm in here.
Breathe. Turn on some air.
I did. Maybe I'll get some blooper reel material out of this one. You got any powder on you?
Yeah. You want some?
No. Okay. Hi. I'm Ian Harvey. I'm a massage therapist. This is my friend Rachel. It's Purple Day.
Yeah.
Today we're going to be talking about the hip flexors, specifically the iliacus and the psoas muscles, which together are often referred to as the iliopsoas. These muscles bring your thigh into flexion at the hip, and they also externally rotate the femur. So these can come into play when people are having complex and weird low back and hip pain. When people are having hyperactive iliopsoas muscles, this is often reported as being right along the SI joint, the sacroiliac joint, as being along this inguinal crease right here, so that inguinal ligament is getting rubbed on. And sometimes there will be abdominal pain, and very often there will be low back pain. So let's talk about where iliacus is and where psoas is. Rachel, would you stand up for us, please? So your psoas muscles lie on the anterior portion of your lumbar spine. They're on the front of your low back. They lie deep to the abdominal wall. They lie deep to the viscera. They are behind everything and on the front of those lumbar vertebrae. Your iliacus lies in the bowl of this ilium right here, and both of these join together into a common tendon that inserts into the lesser trochanter. The lesser trochanter is on the medial side of the femur, so that's why it's able to both bring your thigh into flexion and externally rotate it. Rachel, go ahead and lay down with your head over here.
Okay.
A lot of people access the psoas by using a spear hand and by basically diving through this abdominal wall, but I don't think that that's a very body-friendly way of going about this. The psoas is a muscle that's never touched. It's never made contact with. It is well guarded by the spine and by QL and by all of this viscera. So us making contact with it is kind of a bit of an intrusion. So the less intrusive we can make it, the better. So we're going to come at this from a myofascial perspective as always, but that doesn't always mean moving. It doesn't always mean that slow motion. It can sometimes mean static holds, just at interesting angles where we're trying to engage the fascia that contains that psoas and that iliacus. So to do this, I'm going to place a soft hand on the abdomen. My initial intention is just going to be to make that contact a comforting touch, one that will get her nervous system used to there being a presence there. And as she breathes, and Rachel, feel free to breathe easily and deeply, don't worry if it pushes my hand out a little, that's fine.
Okay.
And as she breathes, her abdominal wall is going to soften. Have your client breathe into their abdomen. Reassure them that it's fine if they push your hand away. And over the next 2 minutes or so, I'm going to sink. As this happens, you may feel a pulse. That's the aorta. Don't try to stop that pulse. Not great. If you feel that too strongly, come to the side of it, come a bit laterally. If you can feel that, your client can feel it too, and sometimes that can be a little weird. It can feel funky. So I'm not targeting either iliacus or psoas at this point. I'm just targeting the abdominal wall and the viscera. Over the next minute or so, I'm going to continue sinking. And Rachel, let me know when I've hit a point where it feels like I'm at a good place. It feels like a good stopping point. And your client won't always know what that means. It's one of those you'll know it when you see it kind of things. So, and continue breathing easily. I'm actually going to stand up so that I can get a little more leverage. And I'm trying not to put all of my pressure into the heel of my hand. I don't want just the heel sinking more than the rest of my palm. It's okay if it sinks a little bit more because I want to keep a relatively soft hand, but I don't want to just... So you're starting to feel that pressure? Okay. So I'm going to hang out right here for a little bit, and what I'm going to be feeling for is a melting, a softening of these tissues. I did a bit of an interview with Rachel. She was having some of those symptoms that we were talking about. She was having pain at the SI joint. She was having pain along that inguinal crease. And she has low back and hip stuff. And when that happens, I get a hypothesis in my mind that, hey, maybe it's the hip flexors. I did a quick test. We stretched iliopsoas, which I'm going to show you how to do, and it was strongly positive. It was definitely iliopsoas. It was quite tight, and it had a lot of tone. So that's something that we're going to deal with here. As you do this, viscera is going to be moving out of your way. The small and large intestines and all that other stuff that's in the abdominal cavity is going to be doing what it likes to do, which is slide. When you turn on your side when you're in bed, your viscera slides all the way to the side. So this is what it was meant to do, so don't be too afraid of that happening. You might feel a little gurgling, a little stuff, but don't worry about it. Gurgling is fine, gurgling is good. Alright, so what I'm feeling under my hand is warmth and softening. So at this point, I feel pretty confident that I can do slightly more specific work. So I'm going to start with iliacus because iliacus is slightly less vulnerable. It's right in that bowl of the ilium, so it's not down deep past the viscera. You can contact it pretty much immediately, although I recommend doing so slowly. And Rachel, let me know if this is ever too much.
Okay.
So I'm going to be using my finger pads. I could continue on with the heel of my hand right here. That's just fine, and I could kind of proceed down into the bowl of the ilium. But I'm going to gently switch. And if you aren't quite sure where you are right now, check for the ASIS, that bump on the anterior portion of the ilium, and you're going to be going medial. If you feel a hard structure on the inferior portion of where you're contacting, you might be a little too far down, you might be at the inguinal ligament. So move superiorly slightly. And again, this is going to be a slow sinking process. And I'm using my finger pads, not my fingertips. Fingertips could be too sharp. And Rachel, let me know when this reaches a good stopping point. It should feel a little intense, but not very. Okay.
Okay.
And I'm sinking as she exhales. As she inhales, her abdominal wall is going to tighten up a bit, but as she exhales, I'm going to be able to sink. I'm going to maintain that new position as she inhales, and then I want to sink just a bit more. And this is on the scale of millimeters. Your client will appreciate this being a slow process. Once you have softened this area up some, you can begin to use a little bit more movement. Right now I'm sinking in with the heel of my hand. And I'm changing which direction I'm allowing my pressure to go. Because I'm targeting iliacus, I'm taking my pressure this way, so toward you the viewer, and down toward the floor a bit. And Rachel, go ahead and prop your heel up. Perfect. Okay, and you can rest your leg here. Depending on your client's comfort level, depending on your therapeutic relationship, you may be able to manipulate the leg in different ways, and we're going to play with that a bit. But the more in flexion this hip is, the softer everything is going to be. Was that too much?
Mm-mm.
Okay. So I've reached what I feel like is a good stopping point. I've made contact with iliacus. I'm at a reasonable depth, especially for a first contact, for a first session. And I'm going to hang out here and wait for this to melt even more. What I'm looking for is, at the end of this session, for my client to have a bit more sense of freedom in this hip, a sense of ease in movement. With this, plus some stretches for the hip flexors, you can make a lot of progress with some of this low back hip stuff. If you add some movement to the leg here, sometimes you can get a bit more depth into the abdomen. I'm drawing my heel of hand inferiorly a bit. I'm going for the more inferior portion of iliacus. With this current contact, I'm also working with psoas a bit. Just because I'm in that region, I'm compressing all of the fascia and viscera posteriorly. And the fascia is continuous between iliacus and psoas. Okay, now I'd like to make this more psoas specific. I'm going to kind of pin this leg in place so that she doesn't feel the need to control it in any way. That will allow psoas to be as free as possible. I'm going to transition into finger pad once again. If you'd like landmarks for this, a good place to press is between this ASIS and the umbilicus, the belly button, or at the edge of the six-pack right here. So at the edge of rectus abdominis. If you're still having difficulty making any headway into this region, you can apply some compression of the femur up into the acetabulum. To do that, I would apply some of my body weight to her kneecap. That's going to press that femur superiorly up into that socket joint. That's something that I've been finding a lot of use for lately, is pressing the femur and the humerus into their respective socket joints. Seems to reduce pain pretty quickly in situations where I can't easily make contact because there's too much pain. I'll apply a little compression and suddenly the muscles will let me in. So I've reached a good depth there. If you would like to confirm that you are indeed on Psoas, you can, and Rachel, you don't need to do this, you can have your client bring their knee up toward their chest while you resist that. So you're going to restrain the knee and say, bring that knee toward your chest. If you feel that muscle jump up beneath your fingers, then you found it. But I know where Psoas is. We're old friends. And I'm just going to stick around here. I'm going to wait for more of that melting, and then I'm going to move on to something slightly more kinetic. Okay, so what I would do next is I'm going to work with both iliacus and psoas. I've got the leg pinned between my arm and my body. And now any rocking that I do is going to affect the relationship of this hip, the relationship of the femur and of the pelvis. Any pressure I put forward is going to bring the hip into flexion a bit and compress things down toward the table. Now if I draw my palm downward, I'm working with iliacus. If I press my palm toward her spine, I'm working a bit more with psoas. And what I'm trying to do here is acclimate her nervous system to this pressure. I'm not trying to lengthen, I'm not trying to spread, broaden, differentiate, I'm not trying to work with trigger points, although I could. Right now I'm just trying to get these muscles used to this contact, and by doing this alone I can reduce the tone in these muscles. In future sessions this will likely be a quicker process. This will be something that you can do in a matter of a couple of minutes rather than over the course of 10 minutes. But still don't rush it. So right now I've got the leg the hip in a semi-flexed position. As I draw it down, that's going to lengthen psoas and iliacus. As I bring it up, it's going to give them some slack. And you could think of this as a pin and stretch, but really what I'm just trying to do is give the fascia yet another reason to melt. All right, so if you would like to stretch the iliopsoas, you will need to bring this hip into flexion. So if you place a hand underneath this thigh and then elevate it as you restrain the pelvis, then the rocking of your body is going to create that extension. And from here you can do things like PNF stretching. I'm sure there's good videos on that out there. But if you've got complicated hip pain, make sure to work with iliopsoas. Work with everything along the SI joint. I've got another video on that which is aimed toward sciatica, but it's definitely applicable here. And work with the low back, and that's actually the next video that I'm going to do. Give this a try. Let me know how this slower style works for you. Hit me up in the comments and subscribe maybe if you want to. I don't know. And I'll see you next time.